I hope all of you have had a great weekend. I hope you're looking forward to a deep night of sleep. At least people in India right now, I know it's morning in other parts of the world. Thanks for making time for this today. A lot of people write in with, hey Luke, I have lower back pain, I have upper back pain. And a lot of people are told to go for surgery when the pain is chronic. Absolutely, you should listen to your doctor. But before that, you need to see if you can solve the problem that is causing your lower back pain. Of course, right now as we speak, I have a patient who met with a road accident 3 days ago, shattered spine, will need surgery. Then we have a lot of people who have sitting jobs. Pilots sitting on long New York, India flights, 14 hours, 15 hours. Of course, they get their break, but primarily they're sitting. Your doctors consulting with patients, your people in corporates, their job requires them to sit. Over that, we have the fear that, hey, sitting is the new smoking. That's a little bit exaggerated. For everything that there is that may not be too good for us, there's a way to counter it. Like in my line of medicine, which is integrative and lifestyle medicine, when our patients come to us with cancer, they're on chemotherapy, they're on radiation, they're on diabetic drugs, they're on statins, they're on immunosuppressants for autoimmune conditions. It doesn't matter. We're not alternative medicine. We don't tell them not to believe in allopathy. Our job is to study the medication, understand the side effects, what it's depleting from the body, which organs it's harming and collateral damage, and our job is to fix that. If chemotherapy is depleting all class A proteins, B, vitamins, C, E, our job is to put that back into the patient through food and, if necessary, supplementation. If a patient is on an immunosuppressant or a steroid, it's depleting zinc, it's depleting copper, it's depleting vitamin E. Our job is to put it back into the patient to manage collateral damage. It's the same thing with sitting. If you have a sitting job and you can't change that job, do you become a victim to fear? No. Sitting has been over-exaggerated in negative terms. The more you sit, there's a simple thing that you need to do. You need to do certain easy exercises or stretches that counter it. Like for example, if I'm sitting in one place for many, many hours, I am going to have tight hip flexors and weak hip flexors. I'm going to have tight glutes and weak glutes. My core over time is going to weaken. My posture is going to change. My blood circulation is going to decrease. Now, if I do simple stretches that can counter this, sitting is not going to be the cause of my lower back pain. Coming back to surgeries, so many people who have come to us and they've been told to go through surgery. Like I said, I'm not against you, not against what your doctor's telling you, but hey, first fix the root cause, because you can do all the surgery in the world, but if you still have tight and weak glutes, a weak core, tight and weak hip flexors, you're always going to have problems. So today, of course, I'm going to tell you the top 5. There are many simple stretches, and the beauty of these stretches that I teach you today can all be done in less than 5 minutes. So you can do it during the day, you can make it part of your workout. Or let's say you got through a rough day and you didn't have time for a workout. At least do these stretches. Of course, if you already have severe lower back pain, please keep your doctor in the loop, because there are many kinds of lower back pain. But the beauty is these stretches that I teach you today, and I want you to keep a pen and paper handy, because I want you to write them down. I can't demonstrate it for you. I will make a video on this at some point. But all you got to do, if you don't know how to do this, put it on YouTube, and you'll have a simple demonstration on how to do it. You don't need any equipment. So the simple thing is understanding. How do you counter something that is causing you a problem? Like for example, I ate too much of junk. How do I counter it? Do I start talking negatively to myself, saying I'm useless, I can never get it right? Or do I take a counteraction? My next 2, 3, 4 meals are going to be absolutely clean. I'm going to miss my workout. Maybe you had 1 or 2 nights of sleep deprivation. It's affecting your immune system. It's affecting your mood. What's the counteraction? Trying to get the third night right to sleep well. So you say there's a counteraction for everything. And if you take that, it minimizes the negative effects of what your job may require you to do. So many people are living in fear. Luke, should I change my job? It requires me to sit. No, don't change your job. Change your lifestyle. If your job requires you to sit, how do I build around that? If your job requires you to stand, how do I build around that? Maybe I'm bedridden. How do I build around that? Maybe I have a fracture. I can't walk, I can't work out. How do I build around that? There are always little things that we can do. So now, again, most people are told, because they follow all this content, like all the content on social media isn't bad, but a lot of it is confusing. You have weak glutes, you have a weak core, you have weak hip flexors. Well, when you're assessing yourself, you have to understand that weak has to be strengthened. A lot of people think just stretching will help them with their hip flexors. Remember, I said tight and weak. So if you have tight hip flexors, stretching can definitely give you some comfort and relief. But to reduce that tightness over time, you got to strengthen your hip flexors. If you have tight glutes, you got to strengthen them. You got to put a load on them through simple exercises with your own body weight or with weights that you can speak to your trainer about. Now, if you have a paper and pen handy, or someone will be kind enough to write this down in the group, the simplest exercises to counter sitting. You can start off with 1, you can do 2, you can do 5. I do just 3 of them. All right, the first one is cat and cow. It's a simple yoga asana, one of the easiest. Remember, everything I'm telling you, please take it with vitamin C, common sense. If you're already struggling with a severe back problem, run this by your doctor or your physiotherapist before you do it, because I do not know the extent of your problem. So cat and cow. YouTube it if you don't know how to do it. The second, my favorite, child pose. But over here, I'm going to add the side stretch. When I'm in child pose, I'm going to move to the left, stay for 30 seconds, move to the right, stay for 30 seconds, and come back front and stay for however long I want. YouTube it if you do not know how to do child pose. The bridge pose. This is absolutely fantastic. Absolutely fantastic. If you've been sitting all day, you can do a bridge pose. Again, as it starts to get too easy because you're practicing consistently. Remember, consistency is gold. Action is gold. Then you start to maybe use resistance bands. That's when I said you put load. When you put load, it starts getting stronger. So we have the bridge. Then we have bird dog. This is beautiful. All of this, you don't need equipment. Bird dog is extremely easy. I want you to YouTube it. I promise I will make a video of all of these 5 and send it to you soon. But tonight, after this, all you got to do is go on YouTube and look at simple videos on how to do the bird dog. Then you do simple spinal twists. Like, for example, I can show that to you right now. I'm sitting on a chair, and all I do is I twist towards the right, and then I twist towards the left. You can do this on your yoga mat. You can do this in bed. A simple supine spinal twist. And standing stretches, where you just stand up if you're sitting too long, hands up, and you slowly stretch to the left and towards the right. And finally, we have something called the happy baby. The happy baby pose is beautiful. You can end it with this. Now, like I said, you don't have to do all of these. Select 2 or 3. And this is mandatory if you have a sitting job. Otherwise, remember, you don't have a counteraction. You need to counter. You need to make sure that you are countering all the actions which are. So if you're sitting, you got to do these exercises. Make it like brushing your teeth. And I can promise you, because I have so many clients who just started doing this, and their back pain started to get better and better and better. And then some people who want instant gratification, they don't want to do the work, they choose surgery as an option. Let's say you did surgery. I respect your decision. But hey, after surgery, you still have tight and weak glutes. You still have a weak core. You still have tight and weak hip flexors. Do you think your quality of life is going to improve in any way? The answer is absolutely no. So don't rush into back surgery unless it is absolutely necessary. Sometimes give yourself 1 month to do these simple stretches. You can't do it on your own. Get a physio to teach you. A physio can actually teach you more exercises that I just shared with you. And you may need it specifically for that. Because some people may have one part of the hip flexors with tight. Someone may have a sciatica problem. So sometimes paying for that expertise is necessary. It can save you a surgery. All outcomes of a spinal surgery are never guaranteed. And you know your doctor would tell you that. But rather you try to fix yourself naturally if time allows you and your current condition allows you. And you can be any age doing these particular stretches. And of course you need to know that if your job does allow you every 45 minutes, hour, 1 hour, stand up, walk around, go get a cup of water, hands up, touch your toes, a little spinal twist. All these little things really help you. But at the end of the day, if you sat too much, these are the stretches that you should be doing. I'm going to repeat that again. A cat-cow, a child pose with the side stretches, the bridge pose, you have the bird dog, one of my favorites, the supine spinal twists, standing side stretches. And then you can do happy baby. Like I said, do 1, do 2, do 3, do 4. All of them can be done in less than 6 to 7 minutes, even if you're holding each for a minute. Some of you may hold it for 30 seconds. All you need to do at this point in your life is bring action into your life. There are too many people absorbing more and more information, more and more content, but they lack action. We're at a point in the world where we do not need content overload anymore. We need action with the smallest things. Along with this, your nutrition will be important. You've got to make sure your vitamin D3 levels are good. You're eating magnesium-rich foods. You're eating calcium-rich foods and foods that are anti-inflammatory in nature. Your spices like your turmerics, your gingers, your green leafy vegetables, your nuts and seeds, your fruits, basically everything that nature's given you has anti-inflammatory properties. And that's what we need to do. My whole next week of videos are going to speak about simplicity. You know, I can speak about cancer, uric acid, diabetes, and all of these things. But every day we see patients. What's healing them? Is it more and more content? Or is them taking little actions with things that are the root cause of their diabetes, uric acid, cancer, Alzheimer's, Parkinson's, whatever it is? That's what I'm seeing. A couple of years ago, up till now, I would just be talking about these are ways, scientific ways to reduce uric acid, hair fall, all of that. But at the end of the day, when I keep looking at my data, what is fixing our patients who are successful with their recovery and healing? Just doing the smallest little actions consistently in nutrition, in movement, in sleep, and their emotional wellness. And then the intelligence in your body takes care of the rest. So I hope all of you understand right now, you do not have to live with that lower back pain. And if your sitting job is making it worse, your body's telling you, counteraction is what you need. I hope all of you have a beautiful night and a beautiful Sunday.